Hello, my name is Bray-Chmielowiec, and today we're going to talk a little bit about something called attachment-based family therapy and applying it to the Hori family from the show Hori. First up, let's meet the Hori family. Who are these people? So first up, we have the matriarch of the family, which is Yuriko Hori. And Yuriko is the matriarch. Of course, she's the mother. She works a very, very demanding job. And she's not a huge fan of childcare or household tasks, which kind of is what leads her to push it onto Kyoko, her daughter, but we'll talk a little bit more about that later. And she's a very, very passive-aggressive communicator. Like, she's not great at just directly telling people she's upset with them or what's going on. She's very passive-aggressive in that, which it caused a lot of problems in her marriage. And we'll talk more about that next up when we talk about Kyosuke, who is the patriarch of the family, also works a very demanding job, and has a huge problem reading social cues. He struggles a lot, so he takes a lot of Yuriko's passive aggression literally. He's also very avoidant of conflict. He's not great at directly addressing it, and this leads him to often just leave the family for long periods of time. He'd be like, oh, I have to go work, and he's just burying himself in work and not dealing with what's going on at home. A lot of the times this is because of conflict with his wife. Next up, we have the eldest daughter, Kyoko Hori. She is a high school student. She's very, very popular in school, very academically gifted. And she was a daddy's girl growing up, which is a big part of her character and a big part of what I think is causing the tension between her and Kyosuke. Because now Kyosuke is just abandoning her consistently and part of who's parentifying her. And she's not understanding why this person she was so close to and had such a strong bond with now seems to not really want her. And of course, she was parentified by both of her parents because of her father's absenteeism and her mother really not liking being a mother or doing household tasks and things along those lines. She's also very, very prone to these aggressive outbursts where she is just physically and verbally aggressive towards the people around her. She also often shuts down in response to stress and any kind of dysregulation. A lot of the times when she's really going after people or she's completely shutting down, it is in response to feeling like she's about to be abandoned. Kyoko has a deep, innate fear of abandonment, which causes a lot of the emotional dysregulation she faces. And finally, we have the youngest son, Sota Hori. Now, Sota is in elementary school and he's very, very dependent on his sister. Him and his sister are very, very close. He's very possessive over her. You know, he disturbingly treats Kyoko like a parent to the point that even when both of his parents are available, if he needs some kind of parental support, he doesn't go to Yuriko or Kyosuke, he goes to Kyoko. And it's not like he has any really obvious resentment towards Yuriko or Kyosuke. He just seems to prefer Kyoko and actually view her as his parent rather than his actual parents. So what is attachment-based family therapy? Attachment-based family therapy strengthens the bonds between the family members by capitalizing on human beings' innate desire for secure relationships. It's rooted in attachment theory. Some of the core assumptions with this are that human beings have an innate desire for secure relationships. Our experiences in early childhood will shape how we perceive, form, and maintain relationships later in life, that damaged attachments and insecure attachments can be repaired through therapy, and that family systems are interconnected. Something very important to understand is that there are different attachment styles. You can have a secure attachment style or an insecure attachment style. Within insecure attachment styles, we have these three different versions of insecure attachment. You have disorganized attachment, anxious attachment, and avoidant attachment. So some of the goals of attachment-based family therapy are to strengthen family bonds and create secure attachments among family members, to promote positive dynamics, to repair ruptures in their attachments and rebuild this trust they have with each other, improve emotion regulation, and to improve their communication skills. Some key concepts are the attachment between the family members, the attachment style of the family members, attachment ruptures and repair among the family members, the internal working systems of each individual family member, as well as family systems and emotion regulation as a whole. So I created here a genogram of the Hori family. You can see that the red arrows represent resentment, and you can see that there's arrows going between Yuriko and Kyosuke because they both resent each other. And then, of course, red arrows going from Kyoko to Yuriko and from Kyoko to Kyosuke because she holds resentment towards both of them for parentifying her and to Kyosuke for abandoning her. We see the blue arrow that represents dependence, and that is Sota pointing at Kyoko because he's very dependent on his sister. And then the strained relationships are represented by the dotted line that you can see going from Kyoko to Yuriko and to Kyosuke just because they have a very obviously strained relationship. Because of Sota's young age, I truly don't know if he understands that the dynamic in his family is not normal. And I don't know if he would even perceive the relationship as being strained, which is why I only really put the strained relationship between Kyoko and her parents. So let's talk about engagement and assessment. So I would start by engaging Yuriko because Yuriko seems to be the one that is the most level-headed and the most likely to acknowledge that there are problems within the family that need addressing and need fixing. I would start with some individual sessions and assessments just so that I can build rapport with each family member individually. This would probably really, really help with Kyoko, who is the most likely to not want to open up and to be closed off. I do a biopsychosocial, the adult attachment interview for Kyoko, Kyosuke, and Yuriko, and then the child attachment interview for Sota. Now, because Sota is 7 years old, I will have to make sure that his parents are consenting to the things that I'm doing with him. Of course, if they want to be there while I'm interviewing Sota, they'll obviously be allowed. If Sota wants one of his family members, most likely I'd see him asking for Kyoko to be in there. That would be allowed. We'd make sure to be very clear that he's not being tested. This isn't to judge him. He's not in trouble. We just want to learn more about him and about his family when doing these interviews. I'll also make sure that I'm using age-appropriate language and that I'm pulling in aspects of play therapy where necessary to make sure that this is effective for someone of his age and appropriate of his age. Moving into the group session and the group assessments, I would actually start by having the family create a genogram together as almost an exercise and intervention as well as an assessment. This allows the family to themselves visualize the attachment ruptures, visualize where the resentment is, where the problems are, and what's going on. And so that from there, they can create goals and we can all create the goals together. Now, I created my own genogram for my own purposes, but their genogram is the one that we are going to use in session because they're the experts on their lives. I am not an expert on their family. All I know is my observations. So the intervention for attachment-based family therapy has 5 tasks. The first task is a relational reframe, and it's where we go from looking at problem behavior to focusing on parent-child relationships. Now, the problem behavior here could really be anything from Sota's over-reliance on his sister to Kyoko's emotion regulation skills. We just really want to make sure that we go from focusing on that to focusing on improving parent-child relationships. The second task is building an alliance with the adolescents or the children, and this is where we focus on the children and the adolescents' strengths, as well as begin to build an attachment rupture narrative, which will be very, very important to task 4, which is like the key component of attachment-based family therapy. The third task is building an alliance with the parents, and this is where we'll explore with them what are the current stressors going on in their lives that might be affecting their parenting, and also what are their attachment ruptures from their childhoods? How could that be impairing their ability to parent effectively? Task 4 is the attachment task, which is the key task of this form of therapy. This is where the children sit down and very respectfully communicate to their parents their grievances and their struggles, essentially going through that attachment rupture narrative. And the parents acknowledge the child and what they're saying with empathy and understanding. The 5th task is autonomy promoting. And now this one is really the family just practicing the skills they've learned and the therapist making sure that they're able to take accountability for their actions and to use the communication skills and the emotion regulation skills and all the things they've done in therapy outside of therapy so that they don't have to be in therapy for the rest of their lives. So some intervention tools that we'll use are things like I statements to help with communication, just to make sure that we're not making people feel defensive, and to make sure that we're practicing being respectful with communication, because that's a big part of this form of therapy. We've also got mindfulness exercises. These will be especially helpful for Kyoko with her struggle to regulate her emotions. We'll do things like 3, 4, 5 breathing and, grounding exercises like tell me 5 things you can see, 4 things you can hear, things like that. We'll practice, knowing when to stop and do them in the middle of a very stressful environment, and also just practice doing them in general. We might dedicate an entire session to learning about mindfulness. And lastly is role play and reenactment. This would be probably very useful during the attachment task, especially since that can be multiple sessions. And since maybe just that conversation of expressing your grievances and having your parents listen might not be enough. We might need to role play a situation and then process it, or we might need to reenact a situation that was very distressing to the child. For evaluation, we're going to do behavior tracking. We're going to track Kyoko's angry outburst. We're going to track Kyosuke's avoidance of conflict, Yuriko's passive-aggressive communication, and Sote's over-reliance on his sister. We're just going to try to do what we can to measure these, keep track of them, and see if these are improving and if this therapy is beneficial and if we should continue this approach. And then, of course, family feedback is extremely important. They are the experts on their family, on their lives, not us. And if they don't want to keep doing something, they can't be forced to. Self-determination is very, very important. Now, this form of therapy has a lot of strengths. It uses a person and environment approach. It acknowledges that people are a product of their environment. It focuses on healthy relationships and emphasizes the importance of having them and in maintaining them. It's also evidence-based, collaborative, and very flexible. However, there are some limitations. For one, it's not really suitable for families with severe issues that might require more intense treatments, and it has a heavy focus on attachment. And so if the struggle isn't attachment, and attachment isn't the key root of the problem, then this therapy could prove to be quite ineffective. It is also extremely time-consuming. Families as a whole need to be able to dedicate the time to go through this therapy. It is also a very, very complex approach that requires a lot of training, a lot of skill, a lot of knowledge from the therapist providing it. Therefore, that could make it very inaccessible or difficult to access. I hope you enjoyed this discussion of attachment-based family therapy. I hope you were able to learn something, and I hope that you had a good time listening to this. Have a wonderful day.